Recording.
Right, hello. This is Dr. Bernard Willis from the Optimal Wellness Centre in Auckland. I'd like to talk to you today about a condition called Oestrogen Dominance, which is a very common condition in both men and women as they approach middle age. As you probably know, the two hormones, estrogen and progesterone, work in balance during the menstrual cycle. But if there's too much estrogen relative to progesterone, then health problems can occur. What does estrogen dominance do? What symptoms does it produce? A lot of women with estrogen dominance, too much estrogen, have breast problems, breast tenderness, breast cysts, and it also increases the risk of breast cancer because progesterone counteracts the effect of estrogen on the breast tissue, and when progesterone is low relative to estrogen, then the estrogen dominance can increase the risk of breast cancer. A lot of women with estrogen dominance get cold hands and feet. That's also due to its effect on the thyroid gland. They could have decreased sex drive, libido, depression, anxiety, agitation. Dry eyes is another problem. Fat gain, especially on the hip and thighs. And the reverse is also true. If you put on weight on around the hip and thighs, that fat is not just sitting there, it is an organ, an active organ, and it's producing estrogen. So it turns cholesterol into estrogen. And so therefore you have a double whammy, whereas in fact if you're fat, you're producing more estrogen, and that estrogen then produces more fat, and that then produces more estrogen, and you get in this big vicious circle. So that's a big problem, and this is why most women put on weight at the menopause, or just before the menopause. A lot of women with estrogen dominance get headaches, and migraine, tiredness, and it's also a big cause of infertility, because progesterone is necessary for fertility and conception. The other problem that estrogen dominance is very common it causes is irregular bleeding and fibroids. Fibroids are benign tumours that grow in the inside of the uterus and increase the surface area from which bleeding occurs. And that's a big cause of unnecessary hysterectomies, which occur a lot these days. I think if women had their hormones done earlier, then a lot of hysterectomies could be prevented by redressing the balance between estrogen and progesterone. Other than being overweight and having low progesterone, another big cause of estrogen dominance, to which we're all exposed, are what we call xenoestrogens. Environmental estrogens. These are look-alike estrogens that act as estrogens in the body by taking over the estrogen receptors and having the same effects as estrogen. What are xenoestrogens? They're chemicals in the environment. You can't see them, you can't smell them, you can't taste them, and you can't tell which products contain these estrogen lookalikes. And with them, there's nowhere to run to. You can't hide, but they're very common. And I'm just going to read now a short list of some of the products containing these estrogens, these look-alike, these foreign estrogens. The main thing that comes to mind is plastics. Plastics are the worst. They're everywhere. Plastic bags to water bottles, to packaging your food comes in. Plastic is almost impossible to escape. And we think plastic is one of the reasons for the drastic decline in fertility in men. Sperm counts are dropping, and the reason why young girls reach puberty so much earlier these days because of the foreign estrogens that are attacking them. Okay, estrogens are also present in vinyl flooring, detergents, shampoos, deodorants, perfumes, hairsprays, moisturizers. But try and make if you sure that you get these things that are environmental friendly, organic. So make sure that all your household chemicals are as eco, as organic, as green as possible. And try not to use pesticides, and try and have organic fruit and vegetables, which are unlikely to have been sprayed with pesticides. Try and use organic fertilizers on your garden. And then you're doing as much as you can, but at the end of the day it's very difficult to escape them. So what do you do about estrogen dominance? How do you cure it? Well, first of all, the first thing you have to do is correct the progesterone deficiency, usually in the form of progesterone cream, which is applied twice daily, and that helps to counterbalance the estrogen. Okay? The other thing that you need to do is you need to make sure that your liver and your gut is working to its best ability to make sure that estrogen is excreted from the body properly. And so if it's very often necessary to do a liver detox when you have high estrogen levels, and you can take supplements like DIM, which is derived from cruciferous vegetables, things like cauliflower and cabbage, broccoli. They all contain something called DIM, but you can also buy it in a capsule form. So anybody who's got estrogen dominance, eat as many cruciferous vegetables as possible, 2 or 3 times a week if you can. Okay. The other thing, of course, is you've got to make sure that your household is environmentally friendly, and there's also, if you have trouble detoxing, there's a substance called calcium glucarate, which you can take, which helps to slow down absorption of estrogen from the food. So estrogen dominance is very common, and if you're a woman who's had any of these things, endometriosis, fibroids, breast cysts, hysterectomy, then you're quite most likely to have been estrogen dominant throughout your life. So it's a good idea that, particularly if you're overweight, that you have your hormones checked and make sure they're back in balance, and then do all the other things that I've been discussing with you, maybe under the control of a holistic doctor. Thank you.